Surgery or Restylane for 35-year-old. I am interested in improving the appearance of my under eye area. In my case, would you recommend Restylane injections or would surgery be necessary? What would be the recommended procedure? I am 35. Is it likely that the Restylane option might worsen the appearance of my eyes in the long run after its effect wears off?
Thank you for your question. At the age of 35, you have submitted this single photo where you're asking whether to do surgery or whether to do Restylane, and then you're asking whether or not Restylane can affect the appearance long term. So certainly you have a very, very legitimate question. In the modern world, there are more than a few options to consider when it comes to addressing hollowing and puffiness under the eyes. So before we define the solution, let's define the problem. At the age of 35, from the limited photo you submitted, it appears that you have most likely a very thin face and that there is the combination of a slight bulge of puffiness under the eyes, which represents something called lower eyelid fat prolapse. That's lower eyelid fat prolapse is the fat that's normally around your eyes kind of herniating forward, pushing forward slightly to the point where it looks puffy. Now, paradoxically, adjacent to the puffiness is a relative hollow. And there are two areas where the hollow is manifested. One is called the tear trough area, and that's the area just adjacent to the puffy area. And then below the tear trough area is an area called the eyelid-to-cheek junction, sometimes referred to as a V-deformity. Now, this is an area where the bone of the around the eye, called the orbit, previously had a little layer of fat under there, and that fat diminishes and gets thinner so that you see more of the bone structure. Now, if you're already a very thin person, this is something that does tend to happen, and when there's volume loss in the cheek, then you get this overall hollowing appearance. So you have an option, you have a couple of options. And one of the things that I do in my practice is I will explain to my patient how they would likely look if we were to surgically address the puffiness under their eyes, but understanding that the overall appearance of the eyes may require more than just reduction of the puffiness. We would often combine the surgical procedure with platelet-rich plasma as well as Restylane fillers, either at the time of the surgery or later on. Now, when people are at a threshold, and I think you fall kind of in that category, although I can't see a side view of your eyes, where there's only slight puffiness, we can always do a trial where we can strategically place some Restylane, a hyaluronic acid filler. I often combine it with platelet-rich plasma. I find that the benefits of blood supply improvement as well as volume, quality of the skin improvement kind of acts very synergistically with the volume benefits of hyaluronic acid. And so I'll often combine it. And I think it's reasonable to do a trial of using this filler if it's done well, and see how you like the look. And if you like that look, then this is something you can maintain by maybe doing this once or twice a year, depending on how your body metabolizes the filler. Now, if the filler does not help adequately enough, then surgical options are typically would be next steps for us. Again, it's all about communication and understanding what the results would be afterwards. I typically also address the cheek area. As a facial cosmetic surgeon who performs facelifting and cheek implants and facial rejuvenation surgery routinely, I look at the eyes, but I also look at the eyes in the context of the whole face. And very often it's a strategy of balance, of doing not only the focal area of the eyes, but also to enhance the volume of the cheeks. Now, it doesn't mean that you want to look like a pillow or you want to look overdone, but I also make a distinction between correction versus augmentation. So when we're talking about volume loss from genetics and aging, we're talking about correction. So I think at this point, your best answer is really to meet with qualified and experienced cosmetic surgeons who focus a lot on the eye area, and see who you resonate with and start exploring these options. I think there's a very safe option to do the injectable as a first step. The nice thing about hyaluronic acid is that there is an enzyme that called hyaluronidase that we can use to dissolve the material if it turns out to be in excess or causes more puffiness. But it's a good first step, and I'm making that recommendation based on just that single photo. So a three-dimensional examination is certainly, an in-person examination certainly has considerable advantages over just reviewing a single photo. So I hope that was helpful. I wish you the best of luck, and thank you for your question.